to CP Newsroom. I'm Nicola Menzi. Autism, or autism spectrum disorder, affects 1 in every 68 children in America. Some churches have started developing special ministries and programs for their special needs congregants. Yet some families complain that churches continue to fail them in this area. What do Christians need to know about autism, and how can churches better serve their special needs families? Joining us to take a look at the issue is Phoebe Ho, Special Needs Family Director at Chinese Christian Herald Crusades in New York City. Welcome, Phoebe.
Thank you.
All right. So before we get right into this, maybe, can you share a couple of fast facts or stats about autism?
Autism is considered as a neurological disorder that affects the functioning of the brain. And there are three areas of symptoms that categorize autism: impaired social skill, communication difficulties, and also repetitive behaviors. And it's good to consider autism as a spectrum because there is no standard seeing what people with autism should be like. Their symptoms ranges from mild to severe.
Okay, and the age range for autism is from, I'm guessing, very young to adult.
3 years old can be diagnosed.
Okay, so what are the differences when we say autism specifically, and then when we say special needs? What does special needs include?
Special needs include a wide range of population, whoever is in need physically or mentally, or some has family problems. It's really wide range of needs, special needs. Yeah.
Okay, that makes sense. Okay, and so why do you think some churches maybe end up failing families who have special needs children?
According to my understanding, I think a lot of time is not that the church don't welcome this family. I think they all want to include everyone in the church. However, maybe lack of communication and also limited resources, that can be something that affect the result of it. But I think if church can consider serving this population, just like having an overseas mission ministry, that might be easier for the whole church to get an understanding about this mission is about, and then they will, just like having a mission trip, you will get people together to pray about it, to spend weeks and months to do research, their languages, their culture, get to try their food, get to understand some of the challenges they're having in their life. So that in order to be prepared, and eventually you go out, you travel all the way to the country to reach out to those to the population. I think if the church can have that mentality when they serve this family, it might be easier for things to work out.
Okay, you mentioned a lot of things there. So then I'm guessing, although autistic and special needs individuals are like everyone else in general, there are special things that we should keep in mind when we want to interact with someone who is autistic, right? So what kinds of things should we keep in mind?
I think to understand that they are living in a very different world compared to us, because they can be very sensitive to all the stimulants at their environment. All the sensory inputs can be overload to them. So. But other than all the disorder, they are just like typical developed people. They all need to be loved, to be accepted, to be encouraged. They just imagine they are being locked up in a room. Right. We just need to spend some time to find the right key to open and unlock the room. I think it's important for us to really step into their world, to open up, step in, so that they can enter to our world.
Okay, and you work with, I'm guessing, a wide range of individuals from different age groups. So maybe, are there any differences when interacting with a child who is autistic compared to an adult who is autistic?
According to my experience, I don't see there are much difference compared with an adult and a children with autism.
Okay. And so we just mentioned some of the things churches might want to consider or do if they want to develop a program for their autistic congregants or special needs families who are there. And some churches, I guess, I don't know, it's not as well thought out maybe. Some simply just decide they're going to have a separate worship room for their congregants who are autistic, have special needs. So what are your thoughts on that? Some people say, yes, it's necessary. Some people say, well, you're just isolating people. That's not a worship experience. What are your thoughts?
I think having different congregation at some level is necessary, just like we have children worship, youth worship, or worship for people who speak different languages. So I think it's just like that. But however, as long as church needs to find a way to connect all these different congregations to meet and to unify other than worship service, then I think that will be fine.
All right. Well, thank you very much, Phoebe Ho, for your input.
Thank you so much for having me.
This is a very complicated issue, obviously, but from the tips you shared, you show that it is very possible for churches to serve their special needs congregants. All right. So thank you again, and thank you for tuning in to CP Newsroom. See you next time.